Hi everyone, Dr. Nemechek here. I've had a couple email inquiries recently about how effective can the protocol be if your child with autism is, say, in the late teens or in their 20s. And so I want to touch on that. Now, briefly, and I know this isn't applicable to them, but just for everybody, if you can start this, the sooner you start this, the easier it is to get the kids to recover. Okay, waiting is not in your favor. Okay, now when parents come to us and we've got these late teens or 20-year-olds, now we've had several instances where one, they're super aggressive and they may be on multiple medications, and we basically put them all in the same protocol. Now at that age, we have fish oil and olive oil. At that age, pretty much they all need at a minimum continuous rifaximin. Some of them we use continuous rifaximin with maybe twice a day inulin or twice a day partially hydrogenated gargum, PHGG, twice a day right with the rifaximin. And then they get vagal stimulation 5 minutes a day. So that's kind of all of them get the same kind of full court kind of treatment. And we have surprising improvements. It's not as dramatic as when they're little. Because again, if you have a 20-year-old that has autism, I mean, they don't necessarily have developmental delay. In parts of their brain, they got developmental arrest. And the delay can be variable. So you might have, in a 20-year-old, part of their nervous system is 16, part of it's 20, parts 16, parts 12, parts 8, parts 4. And you get a lot of just kind of dysfunction and discoordination of parts of the nervous system, plus of the injuries that could occur that don't fully recover from head injuries, inflammatory things, infections or COVID or fractures or surgeries, the emotional traumas of bullying and being frightened, and not to mention just even the propionic acid injuries early on. You have a lot of that built up too. There's a lot to overcome. But nonetheless, when we put them on, we get some substantial improvements. We've had children who were functionally nonverbal in their 20s who within a year or two have some functional speech in terms of simple commands and being able to interact and things of that sort. The majority of the kids that are very aggressive, we can get them off their medicines with the protocol. Usually in a year or two, they'll be tapering off. One of the things that's really common is so many of them have dental problems, and getting that fixed changes the aggression a lot. So I've had many parents where they're coming to me and they'll say, we wondered if we should follow up, or just kind of like, is it still working? And then they'll go through their notes and look, and they're like, oh my gosh, she's so much different than 6 months ago. And I don't think, I wrestle with personally, are they recovering as fast as they should? Because they don't seem to be recovering in the same wow manner as the young kids. But again, like I said, they've got so much this neurological damage and dysfunction, it would take longer, I would think. And so, but it's pretty harmless. We can generally, the kids are happier, they understand more, they can start talking some. I'm not talking about conversationally, but they can start requesting things and communicating better and being part of family events because their emotional regulation is improved. It helps a lot. And, for these kids, this just might be the starting point. But there's a lot of work being done now in neurology about how to control inflammation and in the brain. And I think some of these advances are going to help us in addition to help these older kids continue to improve. So I think it's well worth it. I think the quality of life can be greatly improved. I don't know about a child at 20 with rather advanced autism ever becoming neurotypical. I'm not suggesting that, but the quality of life for the child and the whole family unit is can greatly improve. So I hope you find that useful. Everybody have a good day. Take care.